Good morning. Welcome to an update. Ross and I are taping on 7/7 at 8:30 in the morning for all of Moorings Park Institute. I'm going to provide a brief business update, then we'll spend the bulk of the time talking about COVID-19. I'll talk about testing, and Ross will talk about our existing protocols and policies. First, the business update. It really hasn't changed from what I've told you before. We have three major areas where we're struggling from operations, and they all relate to census. The My Financials are out. June's out soon. But in IL census, as of June, really the highest we've been all year long, we're at 89% occupancy at Moorings Park and Moorings Park at Gray Oaks. In assisted living now, we are at 95% over at Gray Oaks and 80% here on this campus. Finally, in skilled nursing, the Chateau had their best month since March. We were 94% occupied in February, and in June, 68% occupied in the Chateau. So as NCH began its elective surgeries, we did see a rise in census. It's continuing to rise, but clearly nowhere near historical levels. The result of all that in May was that we had a $62,000 positive operating margin, so we essentially broke even, which is sustainable for a long time, not where we want to be to deliver the quality that we want to deliver and each of you expect. We're $700,000 behind budget through May, and expect that to increase when the June financials are released in a week or so. But because of our financial strength, as you know, A and A+, both have been confirmed recently by Fitch and Standard & Poor's. That's sustainable for a very long time. The other factor with our performance is related to our investments. And we had a great May. We added a lot of positive returns. That put us at negative 1.85% year to date in 2020 through May. If you look at an annual from June 1st of 2019 to May 31st of 2020, our portfolio was actually up 5.58%. I don't know the return percentage, but I also know June created a nice positive investment return for us. It's a quick business update. We're in good shape. We can sustain this for a long time. The more important thing is how we're going to deal with COVID-19. So again, I'm going to go through the data that I've just read this morning in Collier County, and I'm going to provide an update on testing. Then I'll turn it over to Ross, where he can review the current state of our operating procedures. So many great sites with COVID-19 information. I go to the Johns Hopkins ones regularly, the Institute for Health Metrics. I get information from NCH on a regular basis about bed counts and what's going on in the local area. Today, I'm going to cite data from the Florida Public Health Department where you can easily drill down into Collier County. As of 8 a.m. this morning, they were reporting 5,076 positive cases for Collier County. And since the beginning of the virus outbreak, a 13.5% positive test result for everybody that's getting a test. Keep in mind that the goal is to keep that below 10%. And when you have it below 10%, you're bending the curve on the spread of this virus. Gets even worse if you look at the most recent data. The last one posted as of this morning was through 6/28. The previous week, the positive rate was 19.03%. You can also see information like this. In the 5 days ending on July 4th, there were 802 cases. In the 5 days before that, there were 705 positive cases. 1,507 positive cases in the 10 days ending 7/4. That's almost 30% of the cases in Collier County. And remember, we've been at this since early March. It's clearly a sign that the area around us is as dangerous as it has ever been. So what does that tell us to do? At the least, we're going to keep our protective policies in place. Ross is going to review those in a minute. But you also need a personal strategy. Social interaction is one of the greatest values we have here at Moorings Park, but it needs to be done very wisely right now. You know what to do. Wear your mask, not for you, for your neighbor. Keep your distance. Don't touch your eyes or face. Wash your hands frequently. And I'd even suggest you spend some time with the TV, the email, the social media off. Take a walk. Put on your mask when you see other people, but get away from it for a minute or two. Come up with an individual plan for yourself to protect yourself from the virus, to keep yourself emotionally healthy. We'll continue to do our level best to keep inside Moorings Park among the safest places to be, but we encourage you to reach out to the partners in wellness, talk to Katie, talk to Jordan, talk to Celeste. Let us know how we can help. Keep those great ideas coming to Ross and I. Before Ross reviews our protocols, let me discuss testing. As discussed in the memo we sent out yesterday, we've conducted over 1,250 tests since Memorial Day. There's not a day or week that has gone by that we've not expanded and strategically increased our testing. We're doing 3 types of testing: concern-based or contact-based, comprehensive, and then ongoing random sampling. Concern-based or contact-based has been the most effective, according to the data right now, in preventing the spread or limiting the spread of the virus. And that's as soon as we hear about symptoms or as soon as we identify you in contact tracing, a test can be applied. Comprehensive is also very important. We're working through that. You know, we had 432 tests last week that delivered 10 positive results, still a few pending, and 394 negatives. We're conducting hundreds of tests each week, and we're dealing the best we can with supply chain and logistics issues. When we apply these tests, it takes a lot of administrative, staff, and clinical time. We have 3 labs that we're using: Genesis, LabCorp, and I'm not even sure I can say this right, Chiasis. And we depend on the lab based on how quickly they're turning results and how available the supply chain is. We're in the midst of discussions with NCH about using their antibody machine. We expect to wrap that up in this week, whether or not we'll move forward with that or if we'll take a different approach. We can still send people out to several sites in town and get pretty quick results if we don't apply it with one of our labs that are here. We have 2 machines on order, one which is slated to be here sometime in July, and these will be the rapid test machines that will allow us to conduct the test internally. You still need the supplies in the supply chain, but get results within the hour. And the other machine is not slated to be here in July, but hopefully will come 4 to 6 weeks after July ends. A lot of people have sent me ideas about testing, articles about testing. I've really appreciated that. We're learning all we can and doing as much testing as we can logistically and with the supply chain, and are looking for strategic ways to continue to expand that testing. But we know the thing we can do the best is make sure that we take care of ourselves and execute our protocols. I'll turn it over to Ross now and let him review the existing protocols we have in place.
Good morning, and thank you, Dan. I appreciate that. And I'm going to provide you some updated information on policies, protocols. There's actually 4 topics I'd like to address with you in this presentation. I want to add just 1 or 2 additional components to the current status. And then I want to talk about a summary of protocols and procedures that are currently in place. I want to talk to you momentarily about contact tracing and risk threshold, terminology that's used often by the Department of Health, and I know that this is often discussed among our residents as well, and you're seeking answers. Hopefully I can help provide that to you. And then I'd like to kind of address the last topic called where we go from here, and that's actually relatively short because we know little information about, what this virus will do in the future. We don't have any definitive information on a vaccine yet, although they're making great progress. So Dan gave you some great statistical data. Great meaning it's current, not great in that the numbers are rising. You don't have to search very hard to find out that Florida is one of the 3 critical states that's got a rapid rise to COVID cases, the others being Texas and California. And then we know that the Center for Disease Control and even the state of Florida have recognized 4 other states that are high-risk states, those being New York, New Jersey, Connecticut, and Louisiana. I will say this, though, with all the rise in cases that we've seen in Florida, and specifically South Florida, and even more specifically Southwest Florida, the loss of life rate continues to go steadily down. As a matter of fact, that chart is equally as impressive as the number of cases that are going up. We would have expected, I believe the epidemiologists would have expected the cases to rise, not to the level that they have, but certainly rise with the increased amount of testing that is going on, and also the relaxation of a number of the standards that were initially put in place by the governor. But the number of confirmed positive cases, meaning the percentage, has certainly risen to an alarming rate, and that's what concerns us the most. Why is it then that the death rate, the loss rate, has gone down significantly? Well, I think there's a couple of things. One is the number of identified positive cases today that we're seeing, and when I say today, I mean in the last few weeks, has certainly been focused on younger people. And the older adults are not without risk, but they are certainly more shielded today, more today than ever, because we know a lot more than when we first started this back in March. So there is no, shield of armor around our residents and or staff, but we do know that the percentage of those residents that are contracting this disease are extremely low. And Dan just gave you some impressive numbers from Moorings Park. So let me just make that quick comparison. Over the holiday weekend, Collier County had a dangerously high 19%. That started on July 3rd, where Florida recorded 11,400 cases in a single 24-hour period, which, is pretty frightening. With that being said, the testing that Moorings Park did last week revealed, 2% of our campus, which is extremely small. Now, we don't want 2%, we don't want 1%. But in comparison to how our overall greater community is experiencing this pandemic compared to Moorings Park, I think we've got some great protocols in place. Certainly not perfect, but I think we're striking as good a balance as can be obtained right now. So let me move on momentarily here to the issue of protocols and procedures. We still remain in Moorings Park's Phase 3. As you may remember, we have a 4-phase opening process. The state has a 3. So our Phase 3 is really equivalent to the state of Florida's Phase 2. But that means very little to someone. It really comes on down to the specifics. What are the specifics with Phase 3? So just to revisit some of those, mask wearing is expected. And that's for every resident, every staff member, everybody who comes on campus, whether it's a family member, a guest, a visitor, a contractor, makes no difference. Masks are expected. Whenever you are around other people in close vicinity, or inside any building at all, other than your own individual home. So really what that boils down to is unless you're taking a walk out in the open air and nobody else is around you, a mask should be worn by all residents, all staff, and anybody else who's coming on the campus. We've even tightened down more with the contractors because I think it gets confusing for them to talk about, if you're in the open air, you can take your mask off. We just simply say, keep it on, and that's the expectation. We've also encouraged our staff to police this as much as possible. We've gotten some input from residents in a few areas where there has been a breach. We've actually gone back out and talked to them, whether it's the U.S. Mail, FedEx, UPS, any of the, the typical vendors who come in, such as U.S. Foods or Cisco. We're constantly talking to them. And for the most part, and when I say most part, I would say in the high 90s, we are getting compliance and people are very receptive to it. If you are getting out in the greater community, I think it's pretty visible right now that after this recent spike, not only in Florida, but actually throughout the United States. This is being taken much more seriously now, and you can see that the adherence to precautionary measures is probably better now than we've ever seen. More about phase 3 and our policies and procedures right now. Let me speak momentarily here about the social distancing. Social distancing is a term that people are probably tiring of, but it is important. That and the mask alone will probably do more good for preventing cases, contacting the virus between residents or anybody else than anything that we do. And that includes testing. Testing is really determining what has already occurred. We want to exercise preventative measures. We are not focused on damage control. So it's most important that we continue the social distancing as much as possible. When you are inside of a building, we ask you to be very mindful of keeping an adequate distance of at least 6 feet away from other people. And if you have somebody coming toward you, just ask them to please observe that distance. We don't want anybody to be disrespectful to others, but we do ask them to be courteous. At the front gate, we're still conducting temperature checks. That hasn't changed. We have some relatively new thermometers out there. They're very accurate. Occasionally you do get a little lower reading, but that's mostly because the air conditioning is on. But if we do get somebody that has a temperature of 99 degrees or above, and incidentally, the CDC identifies it as 100.4 degrees, we actually use 99 just because we want to take one additional step to be safe. We ask them to pull over, and we have them step out of the automobile and cool off for a few moments, and we'll take the temperature a second time. If we still don't see a drop, we'll wait another few minutes, take it a third time, and if we do not get a standard body temperature of at least 98.6 or below, then we will ask them to turn around, proceed back to their home or other destination, contact their physician, and we strongly encourage that they seek some medical assistance, at least to determine if they are positive or not. We are giving access to visitors, friends, family members. We're providing access to contractors on campus. But as I mentioned earlier, we are requiring, and we're being very disciplined with this, of these people wearing masks, including our own residents. And it would also be helpful if our residents themselves reinforce that with their family members and their friends. Not all facilities or campuses throughout Naples, Florida, and/or Lee County are necessarily practicing the same level of discipline that we are. So it's not automatic. We cannot assume that when someone comes to our gate, they automatically assume that our protocols are the same as where they're coming from. That's not always the case. We do ask a battery of questions or a series of questions at the gate. Those questions really focus on the signs and symptoms of COVID-19, the most common ones. Obviously, if you've been around somebody who has had the disease, are you aware of somebody that you've had close contact with? Do you have any signs such as coughing? Have you had any types of headaches? There are some new ones that the CDC has come out with that were not addressed in the early stages of the virus. Headaches is one. The other one's diarrhea. And then the most recent ones that the health department's been bringing me up to speed on is a loss of taste and smell, a new loss of taste and smell. So these are common symptoms and becoming more common associated with the disease. And we want to have people share with us anything that they might see as a concern on their part. We also ask questions about recent travel. I know that Florida, California, and Texas are now very high on the list. However, we have not taken off the other 4 states that I mentioned earlier. And we're going to continue to ask that. Group activities, at phase 3, we're at no more than 20 people in a consolidated group, and that still requires proper distancing and wearing facial covering. Fitness center, we are running the fitness centers open. However, we're limiting the number of people who can go in at a single time. Our exercise physiologists, fitness team members, they are, well schooled and coached on making sure that we don't get too close. And we all recognize that gyms and fitness centers can be a dangerous place to spread this particular virus. There was a update recently that went out that discussed this, and there was also a newsletter that was sent out by Robert Sorensen on the original campus. And masks can be worn. If there's any concern, somebody who might have a pre-existing condition with COPD or congestive heart failure, anything that could interrupt normal respiration, we strongly encourage you contact your physician first and seek guidance before wearing a mask. Wearing a mask, particularly a surgical mask or something very light, surgical is probably not the best, but something relatively light where you can breathe easy, including extremely thin cloth, should not have much of a restriction on our residents. Wearing something like a N95 or a KN95 would not be advised. Those are too dense. The material is thick. It's designed to filtrate high particulate, and that would definitely restrict somebody's breathing. And the other thing is and this is very unscientific, just go easy. Don't overexert yourself. The goal here is to be mobile, to get some exercise, to move your body. It's not to set any records, so please be safe with that. There has been some questions that have risen recently and addressing the recent protocols that apply to chateau and assisted living environments, including Orchid Terrace and also Oakstone Mangrove. I can settle that relatively quickly. The state government, meaning the Agency for Healthcare Administration, and then in the case of Chateau, the federal government, nothing has changed. This is the area that the state and the federal government have intervened very early in the state of Florida, and Florida's to be commended for that. If you look at the national statistics, certainly New York really has had a tough moment with that situation, and Florida has really gotten off to a good start. That takes nothing away from the loss of life that we've experienced in our high acuity environments, but we have been extremely cautious. Now, that does not come without costs because essentially our residents are cut off from their family members, visitors. That's very painful and very difficult. We probably don't even know the full impact of the effect on a person's mental health on that, but we do know we're keeping them relatively safe right now. So that hasn't changed. Restaurants are open. They're open in the Vines and 105 at Gray Oaks, and they're open at the Park Grill and the Clubhouse at the original campus. These restaurants are open during specified hours, and then the maximum amount of seating in each of those restaurant spaces is no more than 50% of total capacity. What we've been able to do is arrange seating so we can maintain social distance. Now, this is somewhat contraindicated to having a great social experience because it can just be two people at a table. We're doing our best to maintain that distance, and I believe in almost all cases we're able to do that. What we're not able to do right now is provide seating arrangements so that two couples can sit together. We recognize that this is not desirable, but I do think just having some restaurants open is definitely a step in the right direction. And we can have both. We can be safe, and we can still have limited access to our restaurants. Even with the restaurants open, we're still continuing to do home delivery for our dining, and that'll continue perhaps for quite some time. I have no idea of how far it will go because we just don't know what the future holds with the numbers and the rise or the decline. Hopefully there'll be decline, and we can continue to increase capacity in our restaurants. But a lot of this, in fact, all of it is triggered by the governor as well. We follow protocols from the state, or we have, in most cases, maintained a higher level of readiness. In other words, we've been more strict on our campuses, far more in some cases in the state. So just because the state of Florida may grant access or relax certain standards does not mean Moorings Park has And that's relatively easy to follow if you just get on their Florida.gov website. FloridaHealth.gov, I'm sorry. As far as testing go, Dan talked to you about that and talked about the relatively low numbers. We're pleased with that. However, we're continuing on a daily basis to reinforce the importance of precautionary measures among our staff. And we recognize also, as we do some of the tracing with the health department, we recognize that the vulnerability for infections on all of our campuses is actually greater coming from the outside than any type of transmission that would occur from resident to resident. And you know, if you had the opportunity to look at some of the tracing information, which unfortunately is confidential, but you would see that we are showing a much stronger trend to any type of transmission that comes on our campuses are coming from the outside. I want to talk momentarily about those who have decided to leave Moorings Park campuses for the summer months and depart to a northern home or take a trip. Obviously, flights are underway. There is air travel. There's some restriction to international travel right now. I know that each of you who's listening understands the dangers associated with travel, but I did want to talk to you momentarily about what happens when you return back to a Moorings Park community. So if you're coming from one of those locations that I had identified previously, New York, New Jersey, Connecticut, or Louisiana, and then we would certainly include California and Texas on that as well. These are defined still as hotspots. And of course, Florida is, but Florida would be your home. We would automatically have you do a 14-day self-isolation period. Now, you know, is there anything that could prevent that? Well, certainly if there was testing that was done to rule out, that may do it. The other thing is I just named a number of states, but there could be other locations. There could be cities within certain states that I didn't mention that are considered high risk. So what I really wanted to state here is that this return would be on a case-by-case basis. Not so with the states I mentioned, but perhaps additional locations. We would have to look at that. We'll work with you on an individual basis, not to be concerned, and we'll try to be as understanding and reasonable as possible and balance that with safety with our residents and staff. The third topic was contact tracing and risk threshold. So these are terms that are used by the Department of Health, both in Collier County and then at the state level, and I would even go as far as the national level. So as far as contact tracing goes, just to offer a little bit of clarity, Moorings Park engages in contact tracing. And what does that look like? What is that? Well, what it is it's a form. And it's a form with a series of questions. It's important to recognize that Moorings Park has no mandate to conduct contact tracing. Moorings Park has taken the proactive measures to engage in contact tracing because we want to help the Department of Health through their investigative process to obtain information as swiftly as possible. In other words, close these cases as swiftly as possible. The reason why that's so important is because if we can identify sources, we can intervene, or the health department can intervene. It wouldn't be us. So there are really two definitions. This was spoken to in update number 43. The first definition really is about environment. So when we're notified of a case, and that could come from the health department, it could come from a physician, it could come from the resident themselves or a staff member themselves, it could come from a lab. There is a number of ways that we could be notified. We start a contact tracing, and we also ensure that the person is isolated as quickly as possible. That contact tracing that we do is managed by a senior manager. It could be myself, it could be the associate executive director, it could be a department head. And what they essentially do is they contact that person who has received a positive confirmation, and they ask them a series of questions on that sheet. And those questions are very similar to what the health, if not the exact same questions the health department will ask. Questions such as, where have you been? Who do you interact with? Going back over the course of the last 8 to 10 to 12 days, can you walk me through each day as you best remember? Places that you had visited, people you've interacted with, were you wearing PPE? Even right on down to stores, gasoline stations, and so forth. One of the things we're looking for there, most importantly, though, is who did that individual interact with? Was it with residents? Was it with other staff members? Was it with family members at home, and so forth? So we start developing a picture. That's usually done within an hour or two after we're notified. Sometimes it takes a little bit longer because it takes us a while to get a hold of the person who is determined to be positive. And then after we gain that information, we forward that to the health department through a confidential fax phone line. They are very sensitive to making sure we maintain HIPAA standards. And then that information is passed on, and then that generates a phone call, usually between myself and the health department. I spent a good portion of my day, each day, talking with DOH. Most recently, they've actually assigned a dedicated registered nurse solely to our account at Moorings Park, not because we have high numbers, it's actually relatively low, but because of the magnitude or the size of our organization, they have actually assigned us a case manager. So that case manager looks at things very carefully, and then they will give us guidance on what to do, and then they will also conduct their own, what I would call a formal investigation. Now, the health department is running behind right now. I can't say to any level of specificity on how late they are, but they've got an enormous number of cases they're dealing with. So if a person is positive, particularly a resident, and they don't get a phone call from the health department right away, I can only surmise it's because they are so backed up right now. All the more, it's important that we obtain this information as quickly as possible and pass it on to them. So that's the environmental piece. We ask all those questions. We also, for residents in particular, we look at where they live on the campus. Did they have visitation by other residents? Is there anything that may have been done and action taken on their part that could have transmitted the virus? And then, yes, we will contact other residents. And this is standard protocol for us. Again, we exercise extreme sensitivity to HIPAA standards, but we call and we ask them a little bit about how they're feeling and try to trace it that direction as well. A couple of things I do want to dispel for a moment. There has been some comments made by a number of residents about air conditioning systems and the movement of air and transmitting the illness. There's a lot that we don't know about COVID yet. As a matter of fact, things that were brought up in the early stages in March are refuted at this point, and vice versa. However, air conditioning systems throughout all of Moorings Park, even from our oldest community buildings all the way up to Grand Lake, each apartment home has its own self-contained plenum. A plenum is the airspace that is right off the air handling unit. In other words, there's no shared air that goes between homes, none whatsoever. These are all self-contained, no different than a single-family home. Therefore, there is no concern about COVID virus being airborne and then sending it through air conditioning ductwork into an adjacent apartment home or even into the hallway. It is all self-contained into the plenum. Even with all that, there is not a lot of hard science on airborne particulate or the virus being airborne and the chances of that being contracted in a defined space like a small home. The second definition of the risk threshold is something that you've probably also heard quite a bit, and you probably hear it on the nightly news or also on the internet, and that is more about the individual's personal health. And what I'm referring to there is the age of the person. We know that right now the high numbers, the numbers that are soaring, are with younger people, but anyone over 60 is definitely at a higher risk. Those over 70 are at a much higher risk. Anyone who has underlying medical conditions, clearly at a much greater risk. and particularly medical conditions that tie into respiratory challenges. And I mentioned before CHF, COPD, those types of illnesses. Body mass index, the size of someone. The body mass index has indicated so far that the vast majority of people who have expired or are very ill or don't recover very quickly are those that are significantly overweight. The overall state of mind, not discussed frequently, but we do know, and I think, all of the medical experts have repeated this from time to time, that this is taking its toll on a person's mental state. So when it comes to risk threshold, we always have to look at whether a person is depressed, their lack of will to thrive. These things matter. And then the overall frailty of the resident, what's their overall condition? Are they mobile? Can they move their body? There's a number of factors. So that's the second definition of risk threshold. What does this all mean? There is not a single yardstick or a measurement tool that we focus on and say, okay, this person's not at risk, this person is. However, everything that I just explained right there can be put onto a chart that's color-coded. Essentially, it looks very much like a traffic light, green, yellow, red type of concept. And, the better health somebody is in, the lower the age. The environment would matter as well, the number of people that they've been around, were they wearing PPE or not. All that can actually place you into a relatively low, a moderate, or a high-risk category. And then that's really how the health department proceeds with us, is looking at those risks and providing us guidance or next steps, actionable steps, if you will. I wanted to provide that information because I know that this is an area that has stimulated lots of discussion and curiosity and actually even concern by our residents. Last thing is, I mentioned, where do we go? Well, we don't know. We do know that numbers are rising right now. We're doing everything we can on our campuses. There are questions from time to time. Would we roll back and go to a higher state of readiness again? I think that's ultimately the CEO's decision. I think, though, that generally our feelings are right now we're committed to phase 3, and we're committed to all of those aspects of managing phase 3. In other words, we don't want to take our eye off of anything. We want to be extremely vigilant. Rolling back and going to a higher state of readiness is something that perhaps some places are doing. I would also state that there's a cost to be paid for that as well. People can handle but so much, and we have to balance that. I do believe, and I believe in my heart of hearts, we are managing this to the very best of our ability, and I think the numbers are proving that out right now. That doesn't mean that we're not vulnerable to additional cases in the future. I would just simply say that the greatest defense, again, and this is repeating myself over and over again, is keep the distance, wear a mask, and then, and this is for all of our partners and our residents, you and only you determine how you're going to maintain your own social and mental balance. You have to get off the campus, you need to do things. I think all of us feel we just need to get out of the house and take a drive or do something. But I would strongly encourage you to measure each one of those trips off the campus and measure it this way. Look at it and identify what are the risks versus what is the gain. The gain is always balancing your life and having a sense of normalcy. The risk is, what restaurants do you eat at? Are people at least 6 feet apart? Are they wearing masks when they come in? Are they putting a mask on when they leave? Are they cleaning well? And it might take a while to find those places, but that's what I would strongly encourage you to do. Because there's nothing that we can implement at Moorings Park campuses that can take away the risk of somebody not practicing these precautionary measures off our campus. So, that would be off-campus restaurants, retail stores, and so forth. So there's a lot of information there to unpack, so to speak, but I did want to give you an update, and that's exactly where we stand right now. And with that, I'll pass it back to Dan.
Thank you, Ross, for that leadership, for that comprehensive review of everything we're doing. You know, if you step back for a minute, look at where we were a year ago. We had an infectious control policy, weren't thinking about it. December and January, we heard about China. We began to dust them off. But then look at what's happened since March up till now. I think I would be remiss if there are any partners watching this video. Thank you very much. I know you've had work-life balance issues as well, but your dedication to the residents here at Moorings Park has been amazing to me. To the residents of Moorings Park, we've always known that the people that select Moorings Park are amazing, thoughtful achievers. I've read stories of the resilience of the generations that we serve. It's been an honor and privilege to see it firsthand. Thank you for all you're doing. Thank you for the ideas that are coming to us as we together try to do our best to combat this awful virus. Finally, I'll reiterate what Ross said. Take care of yourself. Make a plan. Make a plan for your safety. Make a plan for your mental health. Let us know how we can help. Stay safe. Thank you.